She was once a nurse. Now she sleeps beside a dumpster with a needle still in her arm. Her name is Maria, and she's one of the name Zombieland, not from headlines, but from the people who live there. The thumbnail says Philly Fentanyl War, and that's exactly what this is. A war against a drug so powerful it hijacks the body in seconds. A war against poverty, trauma, and a system that's failed to protect its own. We'll walk through the blocks where people slump over fire hydrants, lie motionless on sidewalks, and live in tents stitched together with hope and desperation. We'll meet Maria and others like her, whose stories reveal not just addiction, but this isn't just Philly. It's a warning, and it's already echoing in cities near you. Viewer takeaway. By the end of this documentary, you won't just understand the crisis. You'll see the choices we still have, the policies we can change, the compassion we can choose, and the people we must never forget. The Ground Zero, Kensington. Walk through Kensington, and you'll feel it before you see it. The air is heavy, not just with the chemical sting of fentanyl, but with something deeper, a kind of quiet collapse. A neighborhood that's still standing, but barely breathing. A shopping cart rattles across cracked pavement. A siren wails in the distance, then fades into the hum of traffic. Beneath it all, there's a silence that doesn't feel peaceful. It feels abandoned. This is Philadelphia's Ground Zero, the epicenter of a crisis that's turned sidewalks into survival zones. Tents line the streets like scars, blue tarps, plastic sheets, and broken umbrellas stitched together into makeshift homes. Beneath them, people sleep curled around their belongings, their bodies half hidden from a world that's already forgotten them. You'll see figures slumped over in broad daylight, frozen mid-step, heads hanging, arms limp. Some are unconscious, some are using. Some are just trying to make it through another hour. And all around them, life goes on. Children walk past on their way to school. Commuters rush to catch buses. And the city, somehow, keeps moving. But Kensington isn't just a place. It's a warning. A mirror held up to a society that's allowed its most vulnerable to fall through every crack. Many of the people here were once housed, once employed, once loved. Veterans, nurses, fathers, daughters. Now they live in tents beside dumpsters, under bridges, or in alleyways where the cold bites harder than the addiction. The fentanyl here is cheap, potent, and everywhere. Dealers operate in plain sight. Users inject openly. And the drug doesn't just sedate, it erases. It turns pain into silence, hunger into numbness, and people into shadows. But these aren't shadows. They're human beings. And Kensington is their last refuge. Not because it's safe, but because it's the only place left where they're not chased away, where the rules of the outside world don't apply, where survival is the only law. What's happening here isn't isolated. It's the result of years of neglect, policy gaps, and broken promises. And unless we understand how it got this bad, we'll never know how to stop it from spreading.
Fentanyl is a downer and crack's an upper, so fentanyl you're like falling asleep and crack you're like, I don't know how to put it, like skitzing and like running around and your eyes are bulging out. And
right.
And fentanyl you get physically addicted.
How did it get this bad? The crisis in Kensington didn't erupt overnight. It's the result of slow erosion of public health systems, affordable housing, and community support. And now, the fallout is etched into the streets. It began with pain. In the late 1990s and early 2000s, prescription opioids were widely distributed to treat chronic pain. Many people, trusting their doctors and the system, became dependent. When prescriptions ran out, some turned to street alternatives like heroin. But then came fentanyl, a synthetic opioid far more potent and far more dangerous. Fentanyl didn't just replace heroin, it overwhelmed it. Its low cost and high potency made it the drug of choice for dealers, and often a deadly surprise for users. In neighborhoods already struggling with poverty and addiction, its arrival was catastrophic. In 2022 alone, Philadelphia recorded over 1,200 overdose deaths, most linked to fentanyl. But drugs alone didn't create this crisis. Housing instability played a major role. As rents rose and affordable housing options shrank, more people found themselves on the streets. Without stable shelter, recovery becomes nearly impossible. Add to that the lack of accessible mental health care, and you have a perfect storm. In Kensington, this storm has been brewing for years. Public services are stretched thin. Outreach teams do what they can, but the need far outweighs the resources. Emergency rooms treat overdoses, but discharge patients back into the same environment. Shelters fill up quickly, and many people are left with nowhere to go. There's also the weight of stigma. Society often sees addiction as a moral failure rather than a health issue. This perception leads to policies that punish rather than support. It leads to silence, avoidance, and a lack of urgency. So, how did it get this bad? Because the systems meant to protect people, housing, healthcare, community support, failed to keep up. Because the warning signs were ignored. Because the people most affected were often the least heard. And now, Kensington stands as a painful reminder. A neighborhood where the consequences of neglect are no longer hidden. Where the question isn't just, how did this happen? But how long can we let it continue? The numbers behind the nightmare. It's one thing to see the tense, the silence, the slow unraveling of a neighborhood. But behind every image is a number. And behind every number, a life that once had a future. In 2023, Philadelphia recorded 1,122 overdose deaths, most of them linked to fentanyl. That's more than 3 lives lost every single day. While this marks a slight decrease from 2022's total of 1,207, the crisis remains deeply entrenched. Kensington, though just one neighborhood, continues to bear a disproportionate share of this loss. The racial breakdown reveals troubling disparities. Overdose deaths among non-Hispanic white residents dropped by 15%. Among non-Hispanic Black residents, the decline was only 5%. And among Hispanic residents, overdose deaths actually rose by 2%. The crisis is not just persistent, it's uneven. Nationally, synthetic opioids like fentanyl remain the leading cause of overdose deaths, involved in nearly 70% of all fatal overdoses. The drug's potency, low cost, and frequent contamination of other substances make it especially deadly. One misstep, one dose. That's all it takes. But this isn't just about death. It's about displacement. Thousands of Philadelphians are experiencing homelessness, and many live unsheltered in areas like Kensington. A recent survey found that nearly 1 in 4 unsheltered individuals cited substance use as a direct barrier to accessing housing or services. The streets aren't just where they live, they're where they're stuck. And the cost? It's not just emotional. It's economic. The city spends millions annually on emergency response, sanitation, and short-term interventions. But without long-term solutions, stable housing, accessible treatment, mental health care, the cycle continues. The numbers rise, the tents multiply, and the silence deepens. As one paramedic put it, we revive the same people every week. It's like Groundhog Day, but darker. That's not just exhaustion. That's a system on repeat. And it's not just Philadelphia. From Vancouver to Manchester, echoes of Kensington are growing louder. The symptoms may vary, but the root causes are painfully familiar. Poverty, trauma, neglect, and a system that reacts instead of prevents. But numbers can't speak. People can. And in the next chapter, we'll hear from those living this crisis in their own words. Voices from the street. Statistics can shock. Images can disturb. But nothing hits harder than hearing it from the people living it. Take Amber, featured in the documentary Fentanyl Nightmare in Kensington. She was once a college student. One pill turned into daily use, then heroin, then fentanyl. Now she lives in Kensington's open-air drug market, surviving day by day. I didn't think it could happen to me, she says. But it did. Fast. Then there's Luis, interviewed by filmmaker Charlie Min in his documentary Kensington. Luis used to work in landscaping. He lost his job, then his apartment, then his health. I sleep under the train tracks, he told the crew. I don't want to be here. But I don't know how to leave. Denise, another local, lives in a tent but doesn't use drugs. People think everyone out here is an addict. That's not true, she says. Her story reminds us that homelessness and addiction often overlap, but they're not the same. Outreach workers echo the same frustration. One paramedic said, "We revive the same people every week. It's like Groundhog Day, but darker." Another added, "People don't just need detox. They need somewhere to go after, somewhere safe." These voices aren't asking for pity. They're asking to be seen, to be heard, to be treated like people, not problems. There's a quiet dignity in Kensington, in the way people share food, in the way they protect each other from the cold, in the way they still laugh, still hope, still dream, even when the world has stopped looking. And yes, there's pain, deep, layered pain, but there's also resilience. A man named Javi told us, "I know I messed up, but I'm still here. I'm still trying. That has to count for something." These are not just interviews. They're reminders that behind every tent is a story. Behind every statistic is a soul. And behind every collapsed system are people still standing. Barely, but bravely. In the next chapter, we'll ask the hardest question of all. What can actually be done, and who's willing to do it? What can be done? We've seen the streets, we've heard the voices, we've felt the weight of the numbers. Now comes the hardest part. Asking what can actually be done. Because this isn't just a crisis of addiction. It's a crisis of abandonment. And fixing it means rebuilding the systems that were allowed to collapse. Housing. Recovery doesn't happen on a sidewalk. Without stable shelter, every other solution falls apart. Cities like Houston have shown that coordinated housing-first models, where people are given homes before being asked to get clean, can reduce homelessness dramatically. Treatment access. In Kensington, wait lists for rehab can stretch for weeks. That's time people don't have. Expanding low-barrier treatment centers, mobile clinics, and walk-in detox units could save lives. Not eventually, but immediately. Mental health support. Many people on the streets are living with untreated trauma, depression, or schizophrenia. Without mental health care, addiction becomes a form of self-medication. We need more counselors, more outreach, and more compassion, not just prescriptions. Fourth, harm reduction. Controversial to some, but proven effective. Programs that distribute Narcan, offer safe use kits, and even supervised consumption sites don't encourage drug use. They reduce death. They buy time. And sometimes, that time leads to recovery. Fifth, community investment. Kensington didn't become this way in a vacuum. Decades of disinvestment, unemployment, and neglect paved the way. Revitalizing neighborhoods with job training, education, and local leadership isn't charity. It's prevention. And finally, changing the narrative. We must stop seeing addiction as a moral failure. Stop seeing homelessness as laziness. Stop seeing Kensington as a lost cause. Because every person in this crisis is still a person, still worthy of dignity, still capable of change. This won't be easy. It won't be fast. But it's possible. And it starts with asking not just what can be done, but what we're willing to do. In the final chapter, we'll ask the question that lingers after the credits roll. What happens if we don't? What happens if we don't? If we do nothing, Kensington doesn't just stay the same. It gets worse. More tense, more overdoses, more families torn apart, more lives lost quietly, without headlines, without funerals, without anyone noticing. The crisis will spread. It already is. From San Francisco's Tenderloin to Vancouver's downtown Eastside, echoes of Kensington are growing louder. Cities across the US and beyond are facing the same storm. Synthetic opioids, housing collapse, mental health neglect. And without intervention, the map of suffering expands. If we do nothing, we normalize it. We start to see people sleeping on sidewalks as background noise. We stop flinching when we hear sirens. We stop asking how it got this bad and start accepting it as inevitable. But it's not inevitable. It's a choice. Every policy not passed, every shelter not funded, every treatment center not built, every moment of silence is a decision. And the cost isn't just human. It's generational. Children growing up in these neighborhoods absorb the trauma. Communities fracture, trust erodes, and the cycle continues. deeper, darker, harder to break. We can't afford to look away, not anymore. Because what's happening in Kensington isn't just a tragedy. It's a test of our systems, of our compassion, of our willingness to act. If this documentary moved you, don't let it end here. Like this video to help it reach more people. Share it with someone who needs to see it. Comment below. Your voice matters. And subscribe to the channel for more stories that challenge, inform, and inspire. Because change doesn't start in City Hall. It starts with people who refuse to stay silent.